If we were truly working and intending to work collaboratively with the governor by voting to end the peacetime, his authority to extend the peacetime emergency, that would be one thing. But I think it's important to listen closely to what we've heard come from members of the majority party as well as their counterparts in the other chamber. From the outset of the declaration, I've heard numerous members refer to the request by the governor that folks remain in their homes to the extent possible and reduce social distancing, or to increase social distancing as house arrest. We, of course, have seen members parading outside of the governor's house with members of the public who characterize his actions as the actions of a dictator and who characterize the whole pandemic as a hoax. We've heard members condition their support for important legislation that would benefit Minnesotans and help this economy upon his relinquishing the peacetime emergency declaration. In this chamber, we've debated efforts to hamstring the ability to expend funds that have made available that need to be mobilized very, very quickly to respond to the crisis in numerous ways. So much so that even if we're not in session, there would be no way for the governor and the executive branch to mobilize those resources to respond to what is an emergency. Yesterday, we saw the stock market drop in value in almost a record-setting loss in one day. And why? Because it responded to the spikes in the pandemic in places where everything was opened up very irresponsibly, telling us that we are far, far from over this pandemic, and it's still a grave danger. Its transmissibility, its mortality rate, much, much higher than anything we've contended with, and it's much worse than the annual flu that we deal with. Heard members of this body criticize the governor for not doing a deeper dive into, allowing chloroquine to be researched. Now we've shown that despite the fact that the president takes it, it's totally ineffective and, in fact, very harmful. We see numerous members of this very chamber not wearing masks, running around within 1 foot, talking to each other face to face like this, clearly not taking this epidemic seriously, chortling at those of us who are running around with their masks and trying to take it seriously, not so much to protect our own health, but to make sure that we're not carrying it back to friends and family who themselves are vulnerable, out of respect and regard for our family and our fellow citizens. And in this very chamber and running around these hallways, members of this body not wearing masks, thinking this is all a joke and a hoax. So this is what we're being asked to do, be partners with the governor who is using data, who's using research, who's trying to be responsible and also sensitive to the effects on the economy, who's slowly ramping back as data and evidence permits. So, members, if we're truly trying to be a partner with the governor and exercise the authority of this branch, if we had been demonstrated less bad faith that I've witnessed in social media, out in the public, in this chamber, I might be willing to consider this idea. But I think it's far too important, the risks are too great, and we absolutely have to be responding to what Minnesotans need to stay safe and also respond to the responsible use of authority to start opening up the economy and letting people go about their business. And I think that's what the governor has been doing. And as to the issue of the number of deaths and illness that have occurred in our long-term care settings and our seniors, the fact is that we've been reporting differently and in greater numbers, and the federal agency CMS puts us right in the middle of the pack. So the governor hasn't failed us. I certainly think we could do more and do better, and we're making strides. And in fact, I have a bill that's being introduced today that calls for various kinds of measures for COVID-19 transmission protection in those settings. But I need to correct the record. We're right average in the middle of the pack in terms of the level of infection as compared to other states. Thank you, Mr. President.